We've got a system at the moment where there's long waiting lists, there's not much money, everyone's feeling the pinch, and we need to think of ways in which people can see the right people. Patients can see the right clinician and get the right care, and I think FSEM is in a really great, strong position to be innovative in that space.
Sport and exercise medicine consultants and the teams associated with them are vital to support the NHS in a variety of ways, but they particularly complement the services in orthopaedics and rheumatology, physiotherapy and other types of musculoskeletal services.
Sports and exercise medicine, by the very nature of the training that we do, looks at the multidisciplinary team approach, and we're quite used to being put into leadership roles of a multidisciplinary team.
I think one of the perceptions that the public or other doctors may have that FSEM consultants are only working in Premier League football or Premier League rugby or whatever it is, but actually they have a real important role, and their base actually is in NHS care.
Often you find if you speak to patients, they get frustrated by going through a very long journey before they can see the right person. FSEM doctors are in a very good position in that they can be embedded within teams where they can really impact patients at the right point in their journey.
The sports and exercise medicine model of training and delivery is around really giving personalised care to patients. That allows them to not have to tell their story several, even kind of over 10 times to patients, because you can really, in one consultation, start to really understand what matters to them.
We know that across a whole spectrum of diseases, heart disease, cancer, bowel disease, mental health, that being physically active is really important. And exercise medicine deals with all those areas. It can encourage people to be more active, give them pathways of how to become more active, and encourage them to remain active.
We know that exercise is the best preventative and the best treatment for long-term conditions and chronic disease. FSEM consultants are best placed to be able to lead on that and understand how to manage physical activity in patients with chronic disease.
There is a big focus on waiting lists for surgery, but what we know is that many sports and exercise problems don't need surgery, and if they can be managed appropriately at an earlier point, you can ease the strain on the rest of the acute hospital, both in waiting lists and inpatient stays.
I think this is a really exciting time for FSEM because the long-term plan is to essentially move care away from secondary care into the community, and that's where FSEM can really make a big difference.